Did you try? Oh. Okay. Oh. All right. So for those of you who don't know me, my name is Kristen Rushlow. And I just want to say thank you for attending the Priority Health Medicare Advantage Value Added Benefits Refresher. So the purpose of the webinar today is to just make sure that you're aware of the benefits within your plan. With so many added benefits, it's just easy to forget what all comes along with it. So within the next hour or less, I just want to be covering any questions that you have. Feel free to type in the chat box and we will talk about all the priority health benefits. All right, so just a little refresher. Oh, hold on one second. Technical difficulties. Lauren is helping me. Can I lose the notes? Can I go? All right. Hi, right there.
Yeah. Can you still see your stuff? Okay. So I guess just do it. I don't know if you can do it.
Okay, hold on one second.
That's exactly what you're saying. Do you want me to do it on my screen?
Yeah, would that be okay? Then will they be able to hear me?
Yeah, I'm muted.
Okay, hold on one moment. Sorry about that. We're gonna switch this up so that you can see it better and not see all the slides. Can I just?
Yeah, there you go.
All right, I think we got it now. Okay, so here is our team. As you all know Nancy. I am a new member to the team as of this last year, and I will be helping Nancy do the same role that she does. We have Lauren, who I'm sure many of you have met. Lauren helps us with all of our admin. And she also does stuff with Medicare as well. And Sherry, she helps us with administrative stuff as well. So welcome again this morning. Just a little recap here to make sure that you're taking full advantage of your priority health value added benefits. I won't focus on any specific plan, but just an overview since you all have different plans. All right, so all of the plans this year, they have a zero medical deductible for in-network services that you're getting. The monthly premium is going to be based on the county and zip code in which you live. And then this year we have 9 plans available. And again, that does depend too on the county and zip code that you're in. And they have a star rating this year of 4.0 or 4.5, and that's out of a 5-star rating. Each plan is rated, the Star ratings are available each fall, and a plan can get the ratings between 5 stars as determined by the Centers of Medicare and Medicaid Services. And then the network prices are PPO and HMO POS. All right, so all the plans have a max out of pocket, allowing you to see your max exposure for the year. All of the plans actually do for the Priority Health Medicare Advantage. They do all include a Part D prescription drug coverage. There's worldwide coverage for emergency and urgent care services, so you don't have to worry about that when you're traveling. And then also it includes preventative dental, vision, and hearing. Some plans have the over-the-counter purchases that you can get, and they all have the health club membership. And those are all items that we'll talk more about as we go through this. All right, so some of the embedded benefits we have are with Delta Dental for dental, and you have to remain within that network. You get 2 dental cleanings, 2 exams, 1 bite wing x-ray, and 1 brush biopsy per year. Again, just a reminder, make sure that you stay within the Delta Dental network. That way you can get all of the benefits of that. For vision, you need to stay within the iMed network, and that includes a vision exam, 1 retinal imaging test, and then an eyewear allowance that you get for the year. And the eyewear allowance that's built into the plan is $100. And then you also have an option to go out of network and possibly be reimbursed for the eyewear. And then for hearing, we includes a hearing exam, and then you can also get affordable hearing aids. And you have to stay within True Hearing is the network that you need to remain within to get that. So if you need hearing aids, each purchase includes a 60-day trial period and a year of unlimited follow-up visits, along with 80 batteries. So the enhanced dental and vision, if you're looking to have more coverage than what is built into the standard plan, you can upgrade to the enhanced package. This can be added during certain times of the year, and 3 times of the year that it can be added are listed here. So during open enrollment from October 15th to December 7th, and then that would be effective 1/1 of the following year. You also have a grace period for January and February. You can add that. And then you also have, during your initial enrollment, you have 60 days to add it on. So if you aren't sure, and then, you have 2 months to still add it. Otherwise, you always will go back to the open enrollment or January, February grace period. So if you do add the enhanced dental and vision, this is what the dental will look like. You're going to have, for the key plan, it will be $23 would be the monthly premium. And then all the other plans are $29 this year. So the dental benefits, again, you want to remain within Delta Dental Network. And some of those basic dental services that are included are fillings, crown repair, anesthesia, 1 fluoride treatment, and emergency treatment for dental pain per calendar year with a $0 copay. You can get simple extractions, non-surgical, at 50% that you'll be responsible for. And then for major services, all of these are at 50% as well. So oral surgery, crowns, inlays, onlays, root canals, and realigns and repairs to bridges. Dentures per calendar year, 50%, and then the implants. So, but actually those ones are every 5 years at 50%. Now for the vision, again, you need to stay within the iMed network. Built in is that $100 benefit that you get. And then if you add this, it's another 150. So equaling 250 that you can use towards frames or contact lenses. The eye exam and retinal imaging is included at no cost with an iMed provider. So these are some exciting health features to try to keep people healthy. We have Silver Sneakers is the fitness gym membership at no additional costs. If you haven't already signed up, you can easily go to silversneakers.com and create an account, or you can even download the app to a smartphone. Once you have your account, you can search different locations for all different fitness classes. They have over 15,000 locations plus some. So lots of options for you as far as that goes. You can attend classes at multiple locations or as often as you would like. And another neat feature that goes along with the healthy lifestyle of Silver Sneakers is that they actually offer a tuition reimbursement. So each time that you attend a class, you can be earning tuition points, and you can pick your beneficiary of who would be receiving that money. So it could be a grandkid. It doesn't even have to be a family member. It could be an extended family member. You just have to make sure that if you do that, that the student does have to be added to your account by August 31st prior to their senior year of high school. And then every month that you go to visit a different location for the Silver Sneakers, it logs that information. And if you do at least 7 times a month, you earn 250 tuition reward points, and that equals $250. So good thing for college students because school is not cheap. All right, and then Brain HQ is another zero additional cost. It's a personal gym for the brain. You can access online exercises to improve memory, attention, brain speed, and more. And you can do that on a computer, tablet, or phone. My Strength, that is a health club for your mind that allows you to connect with licensed therapists 7 days a week. My Strength offers support for many types of emotional and physical challenges, such as stress or improving sleep, managing chronic pain, and more. And then we also have acupuncture. So the plans include Medicare covered acupuncture for chronic lower back pain, plus 6 additional acupuncture sessions for other diagnoses. Okay, and then over the counter benefit, this is a nice one. All of the plans except for the Merit Priority Health Medicare plan and the Select plan. So the over the counter benefit, depending on, of course, which plan you have, it could be anywhere from $25 to $75 per quarter, and you receive that money on a prepaid card. So hopefully you all received your card. If you haven't for some reason, you can always call and request a new one. The funds are electronically deposited onto that card, and they'll use the same card over and over throughout the year. So don't just use it and throw it away or anything. But if you did misplace it, you can always request a new one. That is a use it or lose it benefit. The used money does not roll over. It would just expire in the next quarter if you didn't use it. And if you purchase the over-the-counter items, you can get things like Band-Aids, eye drops, supplements. You can even get things like bug spray and sunscreen. So there's really a lot of things. So good thing to take advantage of. You can go to Walmart, CVS, Walgreens, or Kroger if you're on the east side of the state. And you can also order online and get delivery. I think it's $35 that you have to spend to get free delivery. So, and let's see, did we say, hold on. Actually, back to the last slide too. So with the over the counter benefit, for There is a food savings program as well, and members can take advantage of this and potentially receive, or not receive, but you can get discounts for up to $2,500 per year. So that is definitely something good to look at. You can use Walmart, Kroger. There are other participating locations. So even if you go to priorityhealth.com and look under the Medicare section, you can see what stores are in your area and who participates, but you can get things, different deals on healthy foods. So like lean meats, yogurt, beans, eggs, things like that. So, and what else do we have? Members can find new offers through weekly emails as well. So you can sign up for that. So. All right, and mom's meals. So you can get proper nutrition after following a discharge from an inpatient hospital stay, psychiatric hospital, or skilled nursing facility. Mom's meals are included in all plans with up to 28 home delivered meals that are ready to reheat. You can get the service up to 4 times per year. And I'm actually curious. So if any of you have used this service, I'm just kind of curious how exactly it worked. Like, did they come and bring you the meals for the week, or what were the meals like? So we definitely would like some feedback on that if any of you have used it. But that is, again, at no additional cost. Thank you. All right, and then Part D, the prescription drug plan coverage. So with Priority Health, the value and key plans, you can actually save on select insulins this year, which is really nice. So that's before you reach the coverage gap and even while you're in it, to help you manage your diabetes. So you can also do mail order if you're interested, and that is going to be with Express Scripts. That would be a 90-day fill with 0 copays for tier 1 and 2 medications. And then if it's 3 through 5, it's going to be a charge depending on. And a big reminder, try to use a preferred pharmacy versus standard, because you definitely will save money there as well. And then GoodRx is another great tool that you guys could use. And you just simply go to goodrx.com and put in your drug with the dosage and frequency, and all these different pharmacies will pop up showing you where you could go to get a better deal potentially. Now, I do have to say, when you go to the coupon, that what you would take into the pharmacy, just make sure in the right below the coupon that you can actually use it, because there are once in a great while you can't use it if you are on Medicare. And then the coverage gap. So once you've reached the coverage gap, you'll pay no more than 25% of the cost for the plan's covered brand name or generic prescriptions. And then a $0 copay network for virtual care, which includes behavioral health. So the virtual care, you can see your primary care physician, a counselor, a specialist, even a dermatologist without leaving your home. That is a nice benefit. No cost physical exam and preventative benefits. And then it's free to talk to your doctor. With Papa Care, that is available on select plans. It's up to 6 hours of in-person or virtual companion care, in-home assistance. Generally, it's college students who help Medicare members who need assistance with transportation, house chores, technology, or any other senior services. These plans also include a concierge, which is a team of individuals who help you navigate different benefits, schedule doctor's appointments, find providers, and other services too. So. All right, and then traveling. So you can travel outside of Michigan or abroad. Travel without worrying, knowing that you can see a doctor anywhere that you go, all while paying your regular in-network costs. So the multi-plan Medicare Advantage network gives you access to find providers when seeking care outside of Michigan. You can also see any provider, you can see any provider outside of Michigan who participates with Medicare. So for those of you who maybe are snowbirds or you regularly travel to different states, you can receive care without having to worry. And then your plan also includes the unlimited worldwide urgent and emergency care. So Assist America. When you're more than 100 miles from home or in a foreign country, Assist America can help you with a variety of things. So coordinate your care during medical traveling if you have an emergency, provide pre-trip assistance. They'll help you find a doctor or pharmacy within your location, help you fill a prescription if you need it. They can even help you locate luggage if you lost your luggage. And a little recap here. We just want to make sure that you're aware of all the benefits and that you're all using those benefits since many of them are at no additional cost for you. Hopefully you have all set up your member accounts. That way you can view your premium balances or download invoices and just kind of manage your account knowing what all is going on. And then another reminder is that open enrollment is from October 15th to December 7th. So please give us a call and we can help you revisit your plan. And then all of that, if you make any changes, that will go into effect the following year, the first of the year. So I just want to assure you that you've all made great choices with having Priority Health Medicare Advantage plans. And please remember that our team is always here to help you if you have any questions. And that wraps up today's webinar. So if anyone has any questions or anything, please let me know. And I will see if I can answer you. If I can't for some reason, I definitely will get back to you. So let's see. Yeah, if I just click over here on the questions, let's see. So, okay, on the food benefits, do you want some more information? So let me see. We'll go back to that. So the food savings program, you can save up to the $2,500 in the year. So they give you different deals for the week. So it is something that you would have to log into or look up. I think that they will you can sign up for a monthly email, and then that way you can see what the deals are at your store. Okay, so if you go to a dentist out of network, how does that process go for reimbursements? So if you do go to a dentist that is not within the Delta Dental, you'll definitely have more costs involved, but let's see. I am not sure how they will reimburse for that since you are out of network. It's likely that they wouldn't reimburse. So I would definitely say within Delta Dental. I'm sure that there is some coverage if you're not within Delta Dental, if your dentist doesn't participate with that network, but I would definitely suggest staying within Delta Dental because we can't really determine how they would reimburse for that. And PapaCare, can you explain how PapaCare works? Actually, so the attachment that I had with the email, with the Zoom link, there are different, everything that we've talked about here, like all the added benefits, there's a different department within priorities. So you can actually go to PapaCare to look online, or you can even call them to see, to be able to use those benefits. They do allow, you can get up to 6 hours of in-person or virtual companion care or home assistance. And then they'll just help you with things like transportation, different chores around your home, technology. But if you call them, then you'll be able to determine what services that you can get from them. And it's the food benefit in addition to the over-the-counter options. So the food benefit, they kind of like include it with the over-the-counter, but it's not, so if you get a $50 quarterly over-the-counter, you get to use that $50. And then the food benefit, they just kind of tie it in like that. Like you might have to show your over-the-counter card to get those discounts when you go to cash out. But you just want to make sure that you are going to the stores that they have listed. Oh, and then Lauren added that the PapaCare is only on select plans, so not every plan has that benefit. I just want to make sure I got everyone's questions. Do you guys have any other questions? Perfect. All right, well, if you have any other questions, please feel free to give us a call too. We can always help you, and definitely use that directory that I sent you that was attached to the Zoom link, because there's a lot of good contacts in there. So thank you for attending, everyone, and I hope you have a great rest of your day. All right, we'll see you later.